Good morning, everyone. My name is Hadiel Zainal, a student nurse from Davao Doctors College. And today I'm going to perform eye assessment return demonstration. Eye assessment helps to detect eye problem at the earlier stage. And regular eye exams give your eye care professional chance to help you to correct or adapt to vision changes and provide you with tips on caring for your eyes. So prior to the conduct of the procedure, first you need to review the client's medical record if available. And also determine the scope of the assessment needed, prepare the necessary equipment. And the equipment are Snellen chart, opaque card, ball pen, pen light, and a notebook. So before doing the assessment, don't forget to perform hand washing. Greet the client politely, introduce yourself, and verify the client's identity using the two identifier, such as her name and her birthday. Ask how the client would like to be called during the assessment. Explain the procedure to the client and how he or she can participate during the assessment. Provide the client the opportunity to clarify, ask or raise any concern. And also ensure the client comfort, privacy, and confidentiality. Good morning, ma'am. My name is Hadil Zainal, your student nurse for today. May I see your wristband, please? Please state your complete name.
Harriya Cabuyaw,
Your birthday, please?
August 9, 1999.
Alright. So, what do you like me to call you?
Just call me Harriya.
Alright, so, Haria, today I'm going to perform eye assessment, whereas I need to check for your eyesight, look for your pupil, and notes for any odd spaces and sizes. And also, I would like you to stand up and sit down. So, do you have any question and clarification before we proceed?
No.
Okay. So, Haria, as you can see, I close all the curtains to protect your comfort, privacy, and confidentiality. So, do you feel comfortable right now?
Yes.
Alright. So, thank you for that. So, now I need you to stand up. Okay, so in this assessment, I'm going to assess your visual acuity, whereas I need you to read the letter that are written in this talent chart. You can see it?
Yes.
Okay, so I need you to read that with your, the first step with your right eye. I need you to read that with this opaque card, like this. Cover your eye. Same as to your left eye. You need to cover it with this opaque card. And the third step, I need you to read the letter that are written in the talent chart with your both eye uncovered. Okay?
Yes.
Okay, so this is the opaque card. Okay, so now you may read the letter.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C L E F O D P C T.
Okay, as well as your left eye. You may now start.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C LEFODPCT.
Right? Okay, can you uncover your eye? And can you read the letter that are written to the Snellen chart with your both eye uncovered?
EFPTOZ LPED PECFD EDFCZP FELOPZD DEFPOTEC LEFODPCT.
Alright, so now you can now sit down. Okay, so can you tell me how many finger that I am raising? Okay,
1, 2, 4, 3, 4.
okay. Next, can you tell me where is the location of my finger pointing at? Okay,
Left, right, up, down. You're pointing yourself.
alright. Okay, ma'am, so for this assessment, can you tell me if you can see the light and where the location is? Okay,
Left,
see it?
yes.
You see it?
Right, down, up.
Alright. For this assessment, I need you to look straight into my eyes and say the word alright if you see my finger wiggling like this. Okay?
Yes.
Alright, so
All right. All right. All right. All right. All right. All right.
okay. So if defect is detected, wiggle the finger from the defected area of the field towards the better version. But to my patient, I don't have any defect noted. Okay, so now let's proceed to the next step, whereas I need to inspect your eyes, your eyebrows, your eyelashes, and your as well as your eyelids. Okay, for your eyes, it's so a line and symmetry, and for your eyebrows, I can see that it is evenly distributed, and for your eyelashes, it's curl. I don't see any edema and lesion, and also to your eyelids. Okay. So can you close your eyes? I will inspect for your lower eyelids. Alright. There's no lesion. There's no edema that I've noted. So now let's proceed to the palpation of your lacrimal gland and your lacrimal sac. So now we'll palpate your lacrimal gland and your sac. Okay. Okay, I don't see any swelling, edema, as well as lesion. So now let's proceed to the depression of your lower eyelid. So can you look up? Okay. Alright. Okay. So now I will inspect your pulvar conjunctiva. Alright. Okay. So next I will inspect your iris and your pupil with my pen light. I will use my pen light. Okay. Alright. I don't see any lesion, swelling, and as well as edema. Okay, so for this step, I will close the light. Okay, I will check for the direct and consensual light reaction of your eyes. I will use this pen light to check. Okay. Alright. So when I shown your right eye, your left eye is constricted, and when I shown pen light to your left eye, your right eye is constricted. So now let's proceed to the next step into the reaction of your pupil to the accommodation. So what I need you to do is I need you to look at the tip of my pen light and at my back. Okay? Look at the tip of my pen light and then at my back. Alright? Look at my pen and then at my back. So now let's proceed to the Hertzberg test. So I want to inspect the reflection of your corneas. I want to look at me straight and I will shine a pen light to your eyes. Look straight, okay? Alright, next. Okay. So now let's proceed to the cardinal field of gaze test. So for this step, I need you to look at the tip of my pen light with your eyes only. Don't move your neck. Okay, Haria?
Yes, ma'am.
Okay. Alright. Now let's proceed for testing your convergence. So in this step, it's simply just follow the pen. Okay? Okay, so Hiria, I would like to sum up all the information. By the way, the information that I will getting to you is safely handed to the doctor. So, for your visual acuity, when you are reading the Snellen's test chart, your right and your left eyes are 20/20, and your eye with the uncovered opaque card as also 20/20. And for your visual field, your upward field is 50 degrees, your downward field is 70 degrees, and so as your nasal field is 50 degrees, and it is normal. For the inspection of your eyes, for the alignment at symmetry, your eyelashes are evenly distributed, and your lashes are curled upward, and as well as your eyelid, it is intact, no discoloration. And when I palpate your lacrimal gland and your lacrimal sac, there was no edema noted and swelling. Your sclera is white, which is normal, and also your vulgar conjunctiva is good. Your iris and your pupil are both normal. Also, your pupil reaction to the accommodation is normal too. And for the cardinal field of gaze test, there's no flickering movement. Okay, so Miss Iria, your tests are in all good normal. You have good eyesight. What would I advise to you? Stop using to your gadgets as well as your cell phone, because cell phone is have an eye radiation that can affect your eyesight. You have good eyesight, and all of the tests that I will being assessed to you is normal. Okay? Thank you for participating to this assessment.